So on the left, these are the 4 we're going to kind of dive into. And there's some extra ones on the right that are kind of new from this year as well that we're not going to talk about in the structured portion. Like, we don't have any slides on them, but we can discuss them after if there's any interest. So specialist booking, which is in general support for specialists that might be at mixed practices or just any doctors that take referrals of any kind. There's a capability now for you to invite patients to book during a specific window of time. And that handles a lot of cases where you don't want patients booking online on their own. It gives you a lot of flexibility. It's still a lot quicker than calling those patients. So we'll show you that. And patient messaging is brand new. And some of you might have tried it. It was just released last week. But in the Cortico plugin, you can send messages and files directly to patients now. And it's a time-saving tool to avoid needing to open up your email inbox and attach a file and go through that whole rigmarole and need to download all the files. So it saves maybe 30 seconds in a given email transaction, which is helpful. And then the terminal is an old feature from way back, but it's been revamped. It's been turned into an iPad. We got rid of the clunky, well, I mean, they're fine, the old one, but we just find it's easier to roll out the iPads, and we've tested the usability is quite good. And Apple puts together a pretty mean touchscreen for the price. So we ended up going that direction with the terminal kiosks and with really good results. And the software has been all redone as well. And lastly, Cortico can be used for private billing now. If you have COVID tests that you want to bill for, you can charge a patient's credit card right at the time of booking. Similar with no-show fees and other types of private services. So my colleague Kelly was going to present this feature. You can see a picture here, but I'm going to stop sharing my screen. Kelly, are you around?
Yes, I can share my screen. Okay, is everyone able to see my screen?
Not yet.
We can see it now.
Okay, perfect, lovely. Okay, hi everyone, my name is Kelly. I'm from the Cortico support team, and I'd like to introduce everyone to the instant messaging platform. We have rolled it out already, but it is still our first iteration, so any feedback would be appreciated. And the intention behind this feature lies in how many kind of tabs that needs to be open in order to send an email to a patient. So you might need to open the master file to find the patient's email. You need the eChart open, and obviously you need your email inbox open as well. So we design this so that everything can be accessible from the eChart. And after you send the email, we also want to make sure that the message that is sent is recorded. So we know that if any lab requisitions are sent, that is dated and timestamped in the patient e-notes. And lastly, these notifications can be sent through text or email. And now I'd like to switch over to the Oscar page to kind of demonstrate how a doctor can incorporate this into their practice. So here we have a test patient, and I'm going to click on E to access the e-notes, eChart. And the bottom right here, we have the instant messaging widget. So once I click on that, very similar to an email interface. And what is great about this is that the patient's email is automatically populated as we're accessing from the patient's eChart. And in the subject line, it'll just let the patient know that the clinic is sending you a message. This can also be changed as well. And once the body paragraph is populated, it is ready to be sent. But we also have this can response button here. So if you find that there are some emails that you are sending that are quite repetitive, they're like similar messages, you can have the can responses ready here. Okay, and then lastly, you would have to check the checkbox here to enable any messages sent to be saved in the e-notes. And then I'm going to send the email. Okay, and there's a little pop-up showing that the message has been successfully sent. And as well as in the e-notes, there's a date and timestamp there. And in next situation, I would like to show how to attach a document. And in order to do so, I will go to Documents. And you would just have to click on this button here. And like you could see here that the lab requisition file is embedded in the notes. And the same way that I've sent the email previously, you just need to add in the body message and send the email away. Okay. And I just kind of lastly want to go back to this page, showing everyone that even though this may kind of, having multiple tabs and things like that is something that can be saving only a little bit of time for one email, but we do understand that these emails will be sent to multiple, like 30 to 40 patients. So we hope that this feature will help save a lot of time.
Thank you, Kelly. Couple questions showed up in there about replies. So if a patient gets this email and they reply, that's going to go to your main clinic email address, although it does show up as do not reply at cortico.ca if they look at the from address. And the reason for that is in order to avoid spam filters and make sure that the patient actually gets it, we need to send it from a validated email address that we are able to validate with all of the servers for deliverability. But when they do reply, it does go back to you directly, and the conversation would be carried on over email. So you might have another question that may, yes, so the text feature is not released yet. You might have seen in the mock-up it's there, and it's not there in the example Kelly was using. So that's coming soon. Another thing that's coming soon is the ability to encrypt your message. So for now, this is just to save you a little time compared to sending a regular email, which most people in British Columbia do, as I've seen. But we would also like to step up to a higher level of security and allow not just the file. The file is currently sent in a redactable, auditable, and in a way where it is scrubbed after 7 days. But the message itself is just a plain text email at this time. So we'll be pursuing OTN certification for the messaging portion, which we have already received for our telehealth, by the way, a couple of weeks ago. And to do that, we'll need to ensure that it's end-to-end encrypted, or at least that's the best possible design. So that'll be coming soon.
And Clark, just one more question from Vanessa. These emails, are these emails one way, outgoing
Correct.
only?
So we're always trying to integrate things into the way that you're used to working. And what we found, what we thought was the most convenient is that a lot of you are already using a secure email program like Hushmail or ProtonMail, or you're simply using Gmail. So when the patient replies, that's going to carry on as a regular email conversation as you may be used to having. It's just for that initial email that you're sending off that's going to be sent from Oscar. Patients replying to texts. If patients reply to a text, they get a message back that says, this isn't a monitored phone number. Please email your clinic. Okay, so let me just, I think Elaine is next to show you specialist booking. And so maybe it's easiest if she just takes over the screen sharing.
Sure, I'll share my screen. Okay, so hi everyone, my name is Elaine and I'm also part of the Cortico success team. And today I'll be showing you the specialist booking feature. So as you may know, with specialist bookings, clinics often have to call patients back and forth to book and confirm their appointments, which can take up a lot of valuable administrative time spent on the phone. So Cortico has created this feature to automate this task by allowing your patients to book their specialist appointments online themselves. So using this feature, you can basically send patients a unique booking link to allow them to book their appointments online. So after you've received a specialist referral and you've added the patient's master file in your Oscar, you can access this page by entering your clinic's Cortico site name and then adding invite-patient-booking at the end. And here's where you can create the booking link for the patient. So you can search for the patient by the healthcare number or date of birth, and the patient's name will appear. And for this provider field, you can select the specialist that they'd like to see. So if your clinic has more than one specialist, you can select them here. So I'm going to select the neurologist. And for the booking range, the patients, it will be defaulted to allow the patient to book on the first available date and up to 30 days. But if you want them to book at a later date, you can change it here. And for the appointment type, you can select if the patient is a new patient or if it's a follow-up appointment. And this information will be accessible in the specialist booking dashboard, which I will be showing you next. And for the booking link expiry date, it will automatically be defaulted to 7 days. So patients won't be able to book any day after that. But that's also customizable if you'd like. So once you have all the fields filled out, you can just click Add Booking. And you can see this is the specialist booking that we've just created. And to send the link to the patient, all you have to do is just click Email Link to Patient. And it will send them the booking link straight to their email, which is on their master file. So now I'll show you what the email looks like and how they'll book. So they'll receive this email and all they have to do is click here and they can just proceed with booking their appointment online as usual, as with any other Cortico appointment. I'm going to select December 13th, continue. And once the patient has booked their appointment, they'll receive an appointment confirmation email. And you can also see that the patient has booked the appointment on the specialist booking dashboard, which I will move to now. So let's refresh the page. And you can see that the specialist booking that we just created, the status is changed and it says the date that the appointment is booked for. And so we booked it for December 13th, so it's reflected here. And on this page, you can also see all the other specialist bookings that you've created. For example, this one here, the status is pending, which means that the patient hasn't booked their appointment yet. So if you'd like, you can send them the booking link again by clicking Email Link to Patient. And it will send them link to their email. And for all specialist appointments, patients will receive a 7, 2, and 1 day email reminder, along with a SMS reminder 90 minutes prior to their appointment. So this will reduce times for your clinic staff having to call the patients and reminding them about their upcoming specialist appointments. So using Cortico's specialist booking feature, you can automate this task and allow your patients to book their appointments online themselves, and they'll receive the reminders for it, which will help save a lot of time for your clinic staff. So that's all for specialist bookings.
Thank you, Elaine. And just to add, one of the interesting feedback that we had, which drove us to develop this feature, is for specialists who triage certain patients and patients that might not be an urgent case, and the specialist wants to specify the next 2 months to see only urgent cases, then they can send this booking link to the patient, and have the booking range for 4, 5, 6 months from now, just so that they could free up that time. So this certainly addresses a lot of that communication gap that exists between MOAs and patients as they book appointments.
Yeah, it could be used for not just specialists, but any case where you want to invite the patient to book. You don't want it public. For example, a complex care case where they have a half-hour appointment, and you don't want just any patient going and booking that. You could easily invite them for that as well. So I think a number of interesting cases are already coming up where people are using this for things other than strictly specialists in their office. I'll just share my screen again. So this one, we're not going to do a live demo of due to time constraints and also not wanting to put a charge on my credit card. But you can now, at the final step of booking, allow the patient to enter a credit card, and they're going to be billed based on any service that they select from a menu. So in this case, $330 for a travel test. Sounds pretty steep, but it's I think it's pretty simple and straightforward. A few clinics are using this. Not currently. So if the patient cancels, it is integrated with Square, which is a pretty nice platform for collecting payments online that just doesn't integrate with Oscar. And Cortico has added that. So you can refund them in Square at your discretion. You might also want to issue a partial refund or something if you have a cancellation fee. That one I think could be probably pretty short and sweet.
On the payments feature, one area that we certainly like to have feedback is, and we'll like to reach out to you separately, is to figure out what your existing workflow is when you do the Oscar billing. Right now, it's not directly integrated into the billing feature, but we certainly like to hear how you guys are using it and how the payments feature would support your clinic. So more to come on that.
Yeah, and I should mention this does incur an additional fee. So the previous two features we looked at are just included in Cortico in any package that you have. But this one, it's a 5% charge, most of which goes to Square. But I think 1.6% goes to Cortico for triaging the payment. So I see a question. Oh, that's just Alice. Okay. Yes, so I could mention that as well. Alice, unless you want to jump in, we've certainly recognized that it's a pretty common workflow to be collecting payment after the booking as well. I imagine you might be more likely to need to be chasing down the fees in that case, but that's definitely another interesting case that we consider implementing if there's demand. So let us know if that's something that you'd be interested in. Lastly is the new kiosk. If you have the old kiosks, talk to us. If you want to upgrade to these, we will buy back the old one for some amount and give you a deal, because we recognize that if you bought the old kiosk and you don't think it's as pretty, that you shouldn't have to buy a new one at full price. For anyone else that's new to these, I think every Cortico customer almost got them before COVID, but at that point we only had I think 5 customers, most of whom are online with us right now, actually. So thank you guys for supporting us for so long and being on the journey. But since COVID, of course, there's been a lot less demand for in-person appointments. So there's only been probably another 5 customers that have installed the terminals. From talking to clinics in case studies and business reviews, this is other than the entire online booking platform, this saves more time than anything else, because it's that greeting function at the front of a clinic where patients are coming in. and they're needing to do intake forms. They're needing to update their demographic information, get checked in so that you know that they're there. Walk-ins need an appointment booked. There are quite a few activities, and this actually does everything. All of the patient intake activities except maybe taking a urine sample. There might be some specific forms that haven't been transferred over to here, but the time savings is very significant, I'd say, compared to other things. So something to think about if you have a lot of foot traffic. Also, when the patient's registering at a terminal, you can imagine there's some concerns with COVID transmission. Thanks. So I think that the consensus has been reached, and there's a lot of doctors in the room, so I would welcome being corrected about this, but that COVID is primarily transmitted through respiratory, through the air, and not through, it doesn't live very long on surfaces, and that hasn't been a major transmission vector. If you have some hand sanitizer there, the terminal could actually prevent the necessity of patients being in close proximity to one another and in close proximity to staff during registration, because with a couple of terminals, you can avoid having a lineup in the first place with multiple patients in the clinic at the same time, and they can be given a number which they can see on their device, and they know when to come in when it's time for them to be seen. For example, waiting from their car, they could be texted when it's time for them to come in, and you can see that they're marked as a here status in Oscar, so you know they're in their car. So I'll just show you how that looks. So this is what the iPad displays. It's a little bit like the online booking, but there's some key differences. We don't need, because it's a secure environment, we don't need to ask the patient to enter their date of birth. They're just going to enter their health card number. And if they don't know their health card number, you can actually enter it for them in Cortico, and it'll update that terminal in real time. So because they're just entering their health card number and they might enter a typo, we're pretty careful here about confirming that this is indeed the right patient. And now, because they're in a secure environment, which is your medical clinic, they can update all of their information, which we don't let people do online because of security. We let patients register online, but once they've registered, they can never update hardly any of this information because we don't want an attacker to somehow see that on the public internet. But this is a secure device, so we don't have that concern, and we're able to allow the patient to keep their entire demographic record fully up to date. So as you can see, everything was pre-filled in because I'd been to this clinic before. If I was a new patient, it would all be blank, and I'd have to fill it all in, creating the master file in your Oscar EMR or Accuro, which a few people, I don't think any Accuro users are here. And of course, the usual consent statement. So I think because I'd already booked as well, I had an appointment, this has just checked me in. So that's updated Oscar to the here status, and that's it. If I didn't have an appointment already, it would issue me a number. So it'd say you're number 9, and there's 6 patients in queue. So they're able to see that on their homepage or on a specific page that can also be displayed on the wall in the clinic if you want to use the take a number system, which we recommend if you have a significant volume of walk-in patients that are getting appointments right as they arrive at the clinic. What if they don't know their number? So the number gets displayed to them pretty prominently, pretty large, and it encourages them to go on their device to where they can see it as well. We've actually been considering having an automated text sent to that patient with their number as well as a further reinforcement. We haven't seen that be a huge issue because the numbers are pretty small. They're only from 0 to 100 and then it cycles. Most people have been able to remember 2 digits, and with a little bit of training, like after the first few days that it's been deployed. Oh, their health card number, right? So we actually did a pilot with a scanner. And I guess that's the same issue, because if they don't even have their card, they can't read it off either. So I think I don't know my health card number right here. So it's saying, please ask a staff member. And I'm signed in as a weird terminal user account, so it's not super easy to show you. But if I was signed in as administrator, then I can also access this terminal from behind the front desk, and I can update this terminal remotely. So if they just tell me that they're John Smith, and maybe they flash their ID, whatever procedure you want to use, you can search them in Cortico from the admin, and you can update the terminal for them. Right. There's no option to sign in with a name. We found the health number has a pretty good balance of security, where it's pretty unlikely that you know someone else's health number.
Yeah, I would like for the care card number, it would have to be care card number. I know, as many of you guys may know, when you're kind of in your Oscar, you could type in John Smith and get 10. There's no way for them to kind of discern which one's theirs without seeing all the date of births and some other information as well.
Yeah. Jordan probably knows the operation of this better than I do from excessive use.
Clark, there was one question about the consent. Is this consent saved anywhere, or does the patient have to agree every time?
That's right. So on the walk-in terminal, we sort of cheat, and it's checked by default. You probably saw there. Oh, I'm going to show you one more thing. Sorry, don't mean to interrupt, but this is kind of cool. I left my session unattended, and it's about to send me back to the start. Because if a patient just leaves in the middle of filling out the terminal, you don't want their health information displayed there. So it actually it prompts them to leave and go back to the beginning. So yeah, sorry, to answer that question. Sorry, what was that one again?
It was a question about consent. Is this consent saved
Right.
anywhere, or does the patient have to agree every time?
Sorry, yeah. So in the online booking, it remembers whether you've consented. In the registration context, if it's a new patient, then they have to check the box. If they're already in your system, then it's auto-filled, because most likely they've consented sometime in the past. Although and then just like if the patient registers online or books online, it's going to send a copy of that agreement to them and to you. So there is a record, but it's just kept via email. It's not automatically connected to the chart. It's just there. If you ever do need to find it, at least it's there. And then Alberta healthcare numbers. Yeah, so that's kind of an Oscar question. You can use any. We have a clinic in Bermuda, actually. I don't think they're here, but they're using really weird looking healthcare numbers, and Cortico doesn't care. It's Oscar itself that looks up that health card number, and Oscar doesn't really have any format constraints generally, but some flavors of Oscar do. Some flavors of Oscar might validate. I know Juno validates that it's a valid healthcare number in some cases. So the short answer is yes. Yeah, and if it doesn't work, just reach out to us, and we'll make sure that it gets addressed. Okay, that is the end of what I had prepared. I'm going to stop